Good evening, everyone. Welcome back to our IG Live with Dr. Babalola. I'm going to wait for her to come back on. I'm not sure. Okay, she's back. Nice. How's everyone doing while we wait for her to come back on? Thank you, Dr. Babalola. Okay, she's back. So she's requesting to join. This is interesting. Technology is such a blessing. Oh, she's back.
Yeah, I heard the ringing that you were talking about
Yes,
now. I just heard it like it was dialing.
yes, it's
But
still dialing. I'm not sure
oh,
what's
you're
happening. And then
hearing it still
yes, and
dialing
then
on
I
your end? Okay, I'm
lost
not.
you.
I heard it when I was trying to come back on, but I'm not hearing it anymore. I don't know what's going on.
One thing I've learned is that technology is IG is still an app at the end of the day,
Yeah.
so it's what it is. But if you can hear me, we'll continue. This is
Okay.
interesting. But I'm echoing. Can you hear that I'm echoing?
No, I can hear you clearly.
Okay. This will work whether we like it or not.
Yes, it will. Can you hear me?
Yes, I hear you.
Okay.
Great.
Okay.
So just for a background for some people that are just coming in, this is the amazing Dr. Babalola. She did an introduction earlier on. People boarded in obesity, lifestyle, and family medicine. And she has her own practice in Atlanta where she takes care of all ages, holistic medicine. And she was giving us an insight into one of the areas of medicine that she prescribes, which is outdoor. Now, many of you don't know, but you can prescribe outdoor the same way you prescribe Tylenol or you prescribe blood pressure medicine. You can prescribe outdoor. And so she was giving us an amazing background of why outdoor is a prescription, the benefits. Sadly, we lost that. I hope we have the recording saved. And I'm just going to allow you go back. It's still echoing. I'm really hoping that it doesn't sound this way when we upload the replay. I don't know what to do.
Yeah. Yeah, I hope not. Yes, but I can't hear it, so let's hope for the best. But yes, as I was saying, um, yeah, as I was saying about outdoor medicine, it is recommended that we all engage in outdoor medicine just because of the numerous benefits of outdoor medicine. Not only does it calm our nerves, it takes us from the fight or flight mode that we're always in. It takes us into the parasympathetic mode, which really decreases the cortisol that just really causes a lot of damage to our vessels. But additionally, outdoor medicine helps to boost our feel good hormones. And at night, when you go outdoor in the morning, it helps to increase our melatonin. So we all have clocks in our bodies. God is just so good how he designs us that we have a clock, but we human beings stay in the way of that clock, right? So the circadian rhythm, you wake up first thing in the morning, you see that sun hits your eyes, the pineal gland, it actually increases serotonin, which is a good feel good hormone. And then at night, it converts to melatonin. So that's another benefit of outdoor medicine. By noon, of course, vitamin D, which is usually between the hours of 10 a.m. to 2. You have that boost of vitamin D. That's the high. I mean, just being outdoors during that time frame for 15 minutes, you get 25,000 IUs of vitamin D
Between
compared to
10
just
o'clock and what time?
and 2
10
p.m. You
and
get,
2
if you're
p.m.
just there for 15 minutes, of course, it varies depending on your skin tone. 25,000 IUs. Can you beat that? So
Amazing.
vitamin, just that outdoor. So you get the feel good, you get the serotonin, you get the melatonin, you get the vitamin D, fresh air, all the things. So outdoor medicine is a phenomenon and we're not getting enough of it. I
Hmm.
have found when I'm busy, when I'm at work and I'm seeing patients, sometimes I don't go out unless I'm intentional about it. So now I
Hmm.
have it on my phone to remind me at noon to go out. So in the morning, within the first hour, it's recommended if you can go out, just go out, fresh air, listen to God's beautiful creations, the birds, get that in. Midday, do it also, and in the evening. So outdoor medicine, I prefer to do my exercise outdoor, but there are times when you want to do it indoor, it's fine. But the prescription, like you said and alluded to, is if we can all spend some time outdoor. And I know there's some seasons that are colder than others, right? And there's some seasons with allergies. You just prepare yourself for those seasons.
Wow. I wish we didn't have the break. It was so good. And then I just wish we didn't have that break. Because you said something very powerful about how outdoor actually reduces the stress hormone levels. Just
Mhm.
being outdoor, it
Yeah,
actually reduces the cortisol stress hormone levels, which is important in the body, you said. But
yeah.
being outdoor has the way it reduces it. I
Hmm.
think that was when I lost you with the ringing. You want to talk about it again because that's really important.
Yeah, yeah. So cortisol is a stress hormone, which we need. So it does get a bad rep, but it plays a significant role in our body, right? It helps to get us prepared and ready for activities. And if there's a lion, it gets us ready. Blood increases to the areas that need to be on effect, right? And alert. So cortisol is good. When we wake up in the morning, melatonin decreases, cortisol goes up to tell us time to get going. So cortisol has its place. But what we find in today's society, we're in this fight or flight mode, where that high level of cortisol, and as good as cortisol can be, if it stays high continuously and it doesn't peak down, it causes damages to the vessels, to the arteries, right? Especially for women, we put a lot of that weight around our waist because it's also a fat storing hormone, right?
Right.
So I mean, it gets blood to all the areas that needs to get you going, but at the same time, if it stays over there and it doesn't mellow down, it causes problems. So when we go outdoor, they tell you there's an adage or a proverb that says, whenever you're stressed, just go for a walk. Why go
Yes,
for a
love
walk
that.
outdoor? Because you get the fresh air, your cortisol goes down, your stress hormone goes down. So that's the benefit of outdoors, an additional benefit when you go out. I know that I have gone outdoors, all the things that I thought were so impossible, and I, just really feel the stress. I feel better when I'm outdoors because what happens, your serotonin is increased, your senses comes alert, right? And you can smell, you can feel, you can sense, you're intentional. And then what happens as an effect? You get into this parasympathetic mode, which is the rest or digest, right? The calm mode. So it's a natural, I mean, it's free too, right? You don't have to pay anybody to go outdoors. Or have you paid anybody to go outdoors? No.
I'm
So
outdoors right now, and
yeah,
I'm actually
and it's
feeling
so
good.
beautiful. I mean, just looking at you outdoor, I'm already feeling good. So yeah, so it's certainly great and fantastic for us to incorporate it into our day-to-day activities, morning, midday, and evening to be outdoors. I've already been outdoors I mean, I make it a habit to go outdoors early in the morning, the first hour, just to set my circadian rhythm. And then noon, somewhere between that 10 and 2, like I said, for vitamin D. And then somewhere in the evenings, I also go
Mhm.
out again. So it's just a beautiful phenomenon, and I like that you're asking about outdoor medicine. Yes,
Yes.
absolutely.
Because you know what? The thing is that many of us are educated. We know some basic information about our health, what we need to do. But there's some prescriptions that we don't know about. Outdoor medicine is such an amazing prescription that people don't know about. I
Hmm.
felt very reluctant stepping out. I was like, I just want to stay indoors on the couch and do this life. But I was like, okay, this is a professor of lifestyle. Oh, by the way, she's a professor of medicine.
Yeah.
And, it was important that, I show up in that strength because I know the benefits. And
Yeah.
having you, just kind of like explain all over, that was really helpful. And so for those that are listening, you have it, all the all the experiences of stress that you might be having, feeling headed and feeling tired, maybe also the prescription of lifestyle of outdoor medicine, in
Mhm.
addition to your other prescriptions that you probably have prescribed by your doctor. Babs, thank you so much. That was really good.
My
Okay,
pleasure.
so getting the ball rolling. Um, do you have any other prescription that's I know we're both orthodox physicians, but there's an aspect of medicine that I'm very interested in, lifestyle medicine. I know you also practice as well. And so, do you have any other prescription in the, I will say, in the lifestyle aspects of medicine that you think would be beneficial for us as women in medicine, or
Yes,
women our
absolutely.
age who are also trying to, just improve their wellness?
Yes, 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 yes. So I love that you asked about lifestyle medicine. And in case you're listening and you're wondering what is lifestyle medicine, because some people still don't know what that means, you know. So lifestyle medicine pretty much is a medical approach that is evidence-based, where you use habits and interventions to not only prevent, we're treating, not managing, we're treating, and in most cases reverse chronic lifestyle related diseases. So when we talk about lifestyle related diseases, we're talking about things like hypertension, diabetes, metabolic syndrome, right? Could be Alzheimer's, renal disease, the lifestyle related. And the reason why we say lifestyle related is because studies have shown that the chronic diseases that unfortunately 70% of the world is impacted by, the primary pulpit is the diet, right? So diet is one, lack of exercise. As a matter of fact, just sitting continuously at a stretch of over 4 hours has been likened to the new smoking. So this is
Mm-hmm.
what we're talking about. You know, why do we have this many? It's predicted that in 2030, you're going to have 1 in 2 people that would already have diabetes. And unfortunately, our children are also going to be impacted by this. So lifestyle medicine is where you focus on your interventions, right? That has been shown to be evidence-based to correct all these issues that you see in our practice, right? In your practice, in my practice, people coming with migraines, people coming with depression, getting to the root cause. The question is, what is your nutrition, right? There's gut medicine, right? The gut mind connection. What are we eating that is affecting the hormones and our microbiome? So other things that I will say for a professional woman that really wants to stay in their optimal well-being is nutrition. Certainly, that's the foundation of
Mm-hmm.
everything. Certainly, we talked about outdoor medicine, but nutrition is key. And again, I'm not here to say be a vegetarian. I'm not here to say don't eat fish, don't eat that. Just here to say predominantly eat plants. Why do I say that? Because 97% we do not meet minimum requirement of fiber, and fiber
Mm-hmm.
is plant. You can't get fiber from your animal products, right? So it's just plants.
Nice.
And so if only 3% is eating and getting the minimum requirement, and in case you're wondering what number are we talking about, it's about 38 for men grams, and then 20, 25, 28 for women. So only 3% are getting it. So nutrition is key
Mm.
because it helps to build our immune system. It helps to help with hormonal imbalance. There's so many things. It helps with, just keep giving us our overall health and well-being. So nutrition is really key. Movement is key. And then the top three that I always talk about is movement as well as sleep.
Sleep.
Sleep is so key. Yeah. So if you get those three together, you will certainly reduce your stress, right? And your social connection. So all of those, there are more, but those are the three that I like to emphasize that
So
we need.
let me just echo them.
Yeah.
Nutrition, predominantly plants.
Yes.
Movement, that's physical activity, making
Yes.
deliberate efforts to move, get moving and get
Yes.
going. And
Yes.
finally, sleep.
Yes, yes. Those are the
Okay.
top three. There are others, and I can, again, stress management. And I love that you're asking about lifestyle medicine because this week is actually
I
lifestyle
was
medicine
going
week.
to say that at the end of this live, but you
Yes.
since you brought this up, I was going to say that I would like us to do another live, not necessarily for the retreat. As I've been saying in my previous lives, I'm not doing this because I'm trying to do ads for the retreat. I already have the postcards for the retreat. I'm
Mm,
trying to create discussions around wellness. I
yes.
feel so strongly that we need to have these discussions around wellness, and
Mm,
I'm out here saying there's so much more to working hard and using medicine. There's so
mhm.
much more to improve your quality of life.
Yeah.
Our generation, we want to live longer, we want to live much more quality lives where we retire, and
Mhm.
so nobody's talking about this. It's all about treatment, treatment, treatment. There's some medicine about prevention, but how about treating with interventions, and that's where it's all about. So for my medical friends and audience, I would like us to have a discussion this week again and just talk about lifestyle medicine, if you will oblige me, maybe between lunch. And just talk
Mm-hmm.
about it. Because some people are going to be asking questions like, oh, really, outdoor medicine, oh, fiber, you know,
Mm-hmm.
and I'm sure they will really benefit. So, we have a date? Because I know you're so busy.
Yeah, we'll see. Definitely. I know that I'm going to be putting some posts out
Hmm.
there and some
Same,
engagement. So we'll see. Definitely.
same.
Yeah. I mean, and for listeners too, feel free to look I mean, it's open for everyone. Lifestyle. I believe that's the name of the page. I mean, you probably can link it because there's going to be a lot of like free resources about the pillars of lifestyle habits. So they can actually go to the ACLM page, but I don't know what
So,
it's called, if it's
I
lifestyle
think the
medicine.
problem is that there's a lot of people that call themselves lifestyle um, providers,
Hmm.
not medical. You know, they're like, if you see their Instagram pages, you say,
Well, I'm
oh,
actually referring
lifestyle.
to the
Yeah, that's what I'm
ACLM.
saying. So that's what I'm
Okay.
saying. Like, so
Okay.
as in, I've realized that even when I talk about lifestyle medicine, many people get confused because they really still don't understand that there's an area of medicine called lifestyle medicine. So this is because there's a lot of people out there, they say, oh, I do lifestyle, I do wellness, you know, I'm a health lifestyle wellness doctor in that sense. And they have no idea about the specialty of lifestyle medicine. So it comes up first before you even get the ACLS. You know, ACLS is more
Ah,
professional.
okay.
So all these
Okay.
lifestyle providers,
Mm-hmm.
so
Mm-hmm.
that's
Mm-hmm.
why I think that if you want to talk about it deliberately, as a prescription for medicine,
Mm-hmm.
we need to keep having those discussions,
Mm-hmm.
about
Mm-hmm.
it.
Yeah.
Okay, so throwing this in as we round off, it's already late and it's a lot of stuff for the week. I put some of your posts out there, and you had these two interesting videos I posted on my page. One, you were doing like the 50 squats and the 50 jumping jacks
Ah,
and
yes,
all
yes,
that.
yes.
Tell us what the story is behind that.
Yeah, I just like to, my personality, I like adventure and I like to push myself and I like to explore and do things. So I saw it and I thought it was fun to explore and do it. Again, for me, it's getting out of my comfort zone. You alluded to it. You said, it's not just about living life, but it's living life happy, well, and, and fulfilled. And for me, if I'm challenged by something and it brings me joy, because we're already in a stressful world as it is so stressful. And even if it's not stress from our own lives, but it could be your best friend or somebody, my one of my very good friends from my previous university sent me a message. She lost her dad, so we take a lot, even if it's not just my own life. We take from what's going on with our neighbors, with our friends. So we need to be intentional about putting ourselves in a headspace of gratitude, right? And in a headspace of joy in spite of our circumstances. And so for me, I love to dance. I love to move my body, just anything that will just make me stay in a state of gratitude. So that was why I saw that and I did it. And as a matter of fact, the other day, sometimes I do goofy dances with my
I know, I
son if
see
if he
that.
obliges me. Or my girls are not always as I guess they're older now, but or my husband if he agrees. So I just encourage listeners, just do something that brings you joy, right?
Mhm.
And then do your best to stay in a state of gratitude, because when you're in a state of gratitude, it changes your whole mindset, and things that seem so impossible, you shift your mindset and it enables you to see other possibilities of hope and peace and joy. So that was what that was about, and it got a lot of
I know
response and it
it was
challenged
really
me.
good. Is that
Mhm.
your routine every day, or that was just for
Oh
the
no, no,
video?
that's not every day. I do squats, yeah. So I've made it. So if anyone hasn't heard of habit stacking, so habit stacking just means what you typically do. add something that will benefit your health to it. So habit stacking. So for instance, I brush my teeth. I do my best to drink a lot of water. So whenever I go to the bathroom, my habit stacking is that as long as the bathroom is clean, if I'm out, out of my home, I squat. So I do about 10 squats. So I'm brushing my teeth, I squat. I go to the bathroom after I wash my hands and do all the things. I squat. So that is a usual routine for me. I stretch in the morning. I stretch again when I use the bathroom, and then in the evenings, because it helps to develop lower, your lower lower extremity muscles. It builds bone mass, right? And we don't want to be struggling in our old age to get up from the bathroom, right? So it really helps me to develop strength and core muscle. So I do that now. The other things that were there, I don't do what was it called, the planks. I don't do that. I used to, but it's not one that I do all the time. But yeah, so some of the things I do, but not the routine, not the whole thing.
That's yeah. At the retreat, we'll ask you about the whole squats and all the other good stuff. But finally, tell us, what do you do for stress management? I know your routine is
Mhm.
incredible. I don't know how you do it in Atlanta with that traffic and all that stuff. But how do you do stress management? You know, how do you do it? Tell us, if you don't mind.
It's very important for me to decrease my stress level because I can be highly stressed. And about 16 years ago, I was so stressed that my blood pressure was so high. It was 220 over 120. I had the worst headache ever. I always talk about this. I mean, even as a doctor, I did not realize that just being stressed alone could get my blood pressure high. Never had blood pressure. I just had my second child. She was less than a week, and I thought, oh, I was just sleep deprived. That was what. But the headache just kept getting worse and worse. And I'm so grateful I went to check my blood pressure because never had blood pressure problems, even though I had a family history of it. So I know. I mean, as a matter of fact, they did all the blood tests, did the head CT, everything, and the doctor said if I had only just waited one more minute, I would have had a stroke or brain bleed or something. That was just how high it was. And he sat by my bedside and he said, whatever is stressing you out, let it go. And I was like, what does he mean? What is stressing me out? So I had to get to the root cause of why my blood pressure was so high. Of course, at the time I wasn't eating so healthy because I was just under a lot of pressure, right? Emotional eating. But it was more the stress, wanting everything to be perfect, wanting everything, at the time I also had OCD. Everything had to just be picture perfect. So what am I trying to say? It's really progress over perfection. So I
Mm,
let go of
mm.
that. Over 3 months, I mean, I was on multiple blood pressure until I could get to a routine that calmed my nerves. Then I was able to get off those medicines. And it's been 16 years, like I said, and I've been off those 3 blood pressure medicines. So what do? I have always been a journaler. I will journal because it helps to release stress. It's a brain dump. But I lost hold of that during residency. It was something I did in medical school and it was great, but I lost it in residency. And then when I finished, for some of our doctors are in residency, you say, oh, once I graduate, life will be better. No, life continues. There's always one thing, but you just have to learn how to manage your stress. And that was what I learned. I picked back journaling, which ended up becoming a book. But I journal. It's a brain dump, so it takes all that thing that is, all the junk that in my head. I journal and I do a lot of deep breathing. Of course, I meditate on the Word of God. I pray. I mentioned that I dance and I sing. So those things are so important to me, and it really, really helps to decrease my stress level. And when I stay in a state of gratitude and progress, not perfection, it really does help me a whole lot. So that's what I encourage people. Pick something that you can do continuously and find a consistent routine around that. And that would help to decrease your stress level.
You see why I said Dr. Bams is phenomenal, right? As in she walks her talk. That's one thing I would say. She walks her talk. And I'm so blessed that, you know, she's in my space, I'm in her space. I would keep all my accolades to the retreat. If you have any people, doctor, friend, family, practicing or not practicing, that you feel needs an overhaul. Like when I say overhaul, 360-degree overhaul, you want them to come to the retreats, and by extension, probably want an appointment with Dr. Babalola. I would say that without even mincing words. I'll have to let you go because it's been a long day and this is my church gear. I haven't the church yet. But I really, really want us to do this again. Just there's a lot of things you said in passing, but in that statement, there's so much juice. There's so much to extract from it. And I'll meet you on the other side. I'll make it work. It could probably be during, like, I'm going to probably do a habit stacking now of adding like some outdoor to my day. So maybe when I'm doing my afternoon outdoor, we could kind of like habit stack, and have a 10 or 15 minutes check-in, and just talk about some of these lifestyle prescriptions. Thank you so much, everyone. Dr. Babalola, any parting words for the week for anybody, or even for me before we end this live?
Well, I want to thank you, Dr. Jimmy, for having this live with me. I've enjoyed talking with you, and thanks for that outdoor. You're making me so jealous. I'm gonna make sure I go back out again. And I want to thank all our listeners, and just for chiming in. I see there's a Dakbo Akindola. Oh, I like that last name. Akindola is like my first name, the last four words. But thank you for all your contribution. I saw Prime Ivy Marietta joined as well. And for all of you listening, I certainly wish you a great week. Again, the key thing is just progress over perfection. If we can just be 1% better than the day before, that's all you need. Our lives, we can't do complication. We just really, and we default back to our usual behavior. So if it's just 1% better, so even if it's like, okay, yeah, you know what, I can't do 10 minutes outdoor, just do 5, right? Maybe if, you just don't like exercise, okay, maybe just do 5 reps or 5 minutes. Just do one thing that is 1% better than the previous day, and we'll take it one day at a time. That's what I'll say. But I certainly wish everybody a great week ahead, and come sign up for the retreat and join us.
Yes,
Let's have a fantastic time together.
yes. I was going to echo something before you ended this. Through lifestyle medicine, through deliberate stress reduction, you're able to um, get wind of 3 blood pressure medicines. That's really important. I've had, and we've had the experience together, patients that were able to get wind of medicine for diabetes, migraine medicine, so there's so much in lifestyle medicine that we want to encourage you to explore. Dr. Babalola is a lifestyle medicine doctor. She's a professor of medicine, emphasis, but she practices lifestyle medicine as well. And I guess hopefully maybe at our next live, we'll talk more about what she does and why I think that's the next future for medicine. Thank you all for coming and have a blessed week ahead.
Thanks.
Bye. Okay, so I have to edit this.